Hey Mayo Therapy friends, it's Dr. David here from El Paso Mayo Physical Therapy. I'm going to be showing you today a hip distraction mobilization going into a manipulation. So for this technique at the hip joint, we're looking at doing that right there. Not that far obviously, but just a little subtle movement. The benefits of this technique are tremendous and vast. Of course, you can increase hip joint mobility. You can increase the range of motion. The biggest benefit that I find is the neural input. It can reduce pain for hip and lower back and sciatica problems. But doing the technique is a bit tricky. You have to line everything up just right and make sure that you're careful with the patient. Now, some things to be concerned about here are some people are really flexible in their hip joints, and it doesn't take a whole lot of force to do that cavitation sensation. And by the way, a side note, the cavitation doesn't seem like other cavitations, like in the spine specifically. You get that little click or that pop sensation in the spine whenever you do a manipulation up there, but in the hip joint, it's more of a clunk or a thud almost. It doesn't really pop or click. So that's just some feedback for you or how to know what feedback to listen to and feel for whenever you're doing this technique. So just watch my body mechanics as well. One thing that I've realized over the years is that I'm a tall guy, I'm a big guy, so I can leverage my strength and my weight to get the technique done a lot easier. But somebody who's smaller relative to the individual that they're working on, you're gonna have to make sure that you're sharp on your technique to get the leverage that you need. So let me go through this with you. I'm gonna do his left leg here. So hand placement is important. You don't want to be on the ankle. You want to be on the lower leg. And the reason for that is because then you're going to lose some of your force transmission to the ankle joint. Now there are times where you might go to the ankle because you're hurting their leg, really hairy legs or sensitive people. Some people are just really sensitive on their skin. It could be your grip. I would adjust there first. Usually holding on over pant legs works pretty good. But there are situations where you might want to be on skin. You just have to let them know that you're going to grab their skin and pull from their skin because it doesn't feel the greatest on skin. Make sure that you're not interlocking your fingers because you can pinch their skin very easily. You want to be like this. Now I do overlap my thumbs, but they're not really interlocked to where it's going to pinch anything, so it should be okay. So then once I'm here, you want to be in the neutral position of the hip, which is a little bit of flexion, a little bit of abduction, and external rotation. There's specific numbers on that. Go check it out if you're confused on how to do it. But what I like to do is feel, because it's not exact on everybody. So for instance, I could feel that if I abduct Kevin here, I start to get a little bit of resistance there, going into more abduction. And if I adduct Kevin about right here, I start to get some resistance. And then I'm holding a little bit of tension, a little bit of distraction here, or traction actually. So right about here is a good abduction amounts for Kevin. Now let's fix internal and external rotation. So I'm gonna go through the motions here to figure out where there's the least amount of resistance. And I find that beyond about there's some resistance. And then going about right here, I feel some resistance. So I'm gonna stay between those two points. Now the flexion is a little interesting because what tends to happen, especially somebody with a hip or sciatica or back problem, as soon as you start doing this right here, they want to help you and they kick in their hip flexors and you can't do the technique very well because they're going to tighten up, But if you keep the leg down on the table, they tend to relax better. So I often just do this technique right here and I get some pretty good success. Only occasionally will I feel the need to have to go into some flexion. So I'm gonna do it from the table here. Now watch my legs. I'm pretty wide, I'm in a good squat position. I'm doing this with good technique. I'm not gonna muscle it, by the way. I'll show you what it looks like when we muscle it. So what I'm doing is I'm sitting back with my body, maintaining the tension through my arms and hands, and I'm feeling for how his leg at the hip joint gives. And if you see his body, he's almost kind of starting to slide on the table just a bit. That's how I know that I'm at the end of the available joint motion. So when I know that I'm there, starting to slide, now I can do my manipulation, just like that. I didn't feel it clunk, which is okay. Sometimes it's not necessary, but I like to try to make it happen here if it's not contraindicated or if you had a good response. So I'm going to give it a little harder pull here. Felt a little baby clunk in there. Scoot up a bit here, Kevin. So I'm just going to show you how I muscle it now. If I were to muscle it, what I mean by that is I'm using my arms and not so much my legs. So see how I'm bending my arms here? I'm still hanging my weight back, but now I'm going to do that right there. I actually have a better one there, right? Mm-hmm. So I'm used to muscling it because I tend to be bigger than most of my patients. But if you are a small person, I would get used to doing it with great technique. Learn it both ways probably is the best answer. So I hope that was helpful for you. This is very, very helpful for people that have hip OA, hip limitations as far as range of motion, hip pain, of course, and sciatica problems benefit tremendously from this as well. Thanks for watching our Manual Therapy Thursday. Catch you later. Bye-bye.